Okay, so ready to dive in. Today we're tackling COPD.
All right. Sounds good.
We're going to be looking at this medical document and really getting into it, like what's going on with this condition, like how it works, and how doctors diagnose and treat it.
Yeah, this is a good one. It's a really, a complex condition.
Yeah, and I think it's something that, a lot of people hear about but don't really, know much about.
Right.
So, if you've ever wondered what COPD is all about, or maybe you know someone who's dealing with it and you want to understand it better, this is for you.
Absolutely.
So COPD, chronic obstructive pulmonary disease.
Yeah.
I mean, just the name itself sounds kind of scary, right?
Yeah, it does.
Like what exactly does that mean? What makes it chronic and obstructive,
Well, chronic, that means we're talking about something that's long-term. It's not going away anytime soon.
Right.
And obstructive, well, that basically means there's something blocking airflow in the lungs, making it harder to breathe.
So it's like a roadblock in your lungs.
Kind of, yeah. And COPD is an umbrella term, actually.
Okay.
It mainly covers two conditions, chronic bronchitis and emphysema.
Okay. So two conditions, but they both fall under this COPD umbrella.
That's right. They often happen together even, but they each do their own thing to the lungs,
So, what's the difference between those two?
So chronic bronchitis, that's where the airways, those tubes that carry air, are constantly irritated and making way too much mucus.
Oh, yuck.
Yeah, not fun. So it's like, imagine trying to breathe through a straw that's slowly getting clogged up.
Yeah, I can see that.
Now, emphysema, that's a bit different. That one's all about damage to those tiny air sacs in your lungs, the alveoli.
Alveoli, right?
Yeah, those are key for getting oxygen in and carbon dioxide out. But with emphysema, it's like those air sacs are getting destroyed, like someone's popping tiny balloons in your lungs.
Wow. Okay, so less air sacs, less space for air to do its thing.
Exactly. Less surface area means your lungs can't work as efficiently.
Okay, so let's say, you're a doctor and a patient walks in and you're suspecting COPD. What are the signs you're looking for?
So we look at a lot of things, right? We check their vitals, look them over head to toe, and really listen to their story, what they're experiencing.
Right.
If their heart's racing and they're breathing fast, that could be a sign their body's working way too hard just to get enough air.
Makes sense.
Then there's the way they look. Someone with COPD might be doing this pursed lip breathing, almost like whistling.
Oh, yeah, I've seen that.
Right. That actually helps keep their airways open longer. Then you might see a barrel chest, from all the air trapped in there. And sometimes even their fingertips get clubbed, which is a sign they haven't been getting enough oxygen for a while.
Wow. So you can tell a lot just by looking.
Oh, yeah. But we also get hands-on. Literally.
What do you mean?
Well, we'd feel their chest, see if it's expanding like it should when they breathe. If it's not, that's another sign the lungs aren't filling properly.
Yeah.
And we tap on their chest, listen to the sound.
Like percussion.
Yeah, exactly. With COPD, you might hear this hollow sound like a drum because all that trapped air changes how the sound travels.
Interesting.
And of course, we use the stethoscope, listen to their lungs. Any wheezing, crackling, or just weak breath sounds, it all points towards blocked airflow.
So it's like putting all these pieces together, a real detective job.
It is, yeah. But a big piece of the puzzle is their history, Have they been smoking a long time? What's their work like? Are they around dust or fumes?
Right. Environment plays a huge role.
Huge. And unfortunately, smoking's the main culprit in most COPD cases.
I was reading about that it's not just the smoke irritating the lungs, but it actually sets off this whole inflammatory process that just makes things worse over time.
Exactly. The chemicals in cigarette smoke, they irritate the lining of those airways, and that leads to chronic inflammation. So the airways swell up, produce more mucus, breathing gets even tougher.
So it's like a vicious cycle.
Totally. And over time, those delicate airway walls get damaged. And that's where the obstruction really sets in.
So it's not just the smoke itself, but the body's reaction to it that's causing the damage.
Exactly. And yeah, while smoking's the most common cause, there are other factors too. Air pollution's a big one. Then there's exposure to certain chemicals and dusts at work.
Right.
And there's even this rare genetic condition, something called alpha-1 antitrypsin deficiency.
Okay, so it's like the lungs are under attack from all these different sides.
Yeah, it's a tough situation. But the good news is we've got ways to diagnose it, definitively,
So how do you go from suspecting COPD to knowing for sure?
Okay, so remember those clues we talked about? They give us a good starting point.
Right.
But to really nail down the diagnosis, we use a test called spirometry.
Spirometry, okay.
Yeah, you basically blow into this tube as hard as you can.
Sounds simple enough.
It is, but it gives us super valuable info. We can measure how much air you exhale and how fast, which tells us a lot about how well your lungs are functioning.
So it's like a ruler for your lungs.
Exactly. And we might also take a look at chest x-rays. Those can show us typical COPD changes in the lungs, like hyperinflation or damage to the alveoli.
Right.
And sometimes we do a blood test called an arterial blood gas analysis. That tells us the oxygen and carbon dioxide levels in your blood, so we know how well your lungs are doing their gas exchange thing.
So you're gathering all this data from different angles to get the full picture.
Precisely. It's like putting together a puzzle.
Okay, so someone's diagnosed with COPD. What happens next? What's the treatment like?
So first things first. While there's no cure for COPD, there's a lot we can do to manage it, help people live well with it, you know?
Okay, that's good to hear.
And the biggest, most important thing, quit smoking. It's the absolute best way to slow down the disease.
Makes total sense.
Yeah.
What about medications? There seem to be quite a few options.
Oh yeah, there are a bunch. We often use bronchodilators. They're inhaled meds that relax the muscles around the airways, making it easier to breathe. Then there are inhaled corticosteroids. Those help reduce inflammation in the airways.
So like calming things down in there.
Yep. And if there's a lung infection, which happens more often with COPD, we might prescribe antibiotics.
So it's a multi-pronged approach.
Definitely. But it's not just about meds, you know? Exercise and lifestyle changes are super important too.
Yeah, that makes sense.
We have these pulmonary rehabilitation programs. They combine exercise, education, and support groups.
Oh, wow.
They teach people breathing techniques, help them build strength, and manage their symptoms. Being active can really make a huge difference.
So it's like, it's not just treating the disease, it's giving people tools to take charge of their health.
Exactly. And in some cases with severe COPD, there's even surgery as an option, but that's usually a last resort.
Right, so lots of different approaches depending on the individual.
Exactly. It's all about finding what works best for each person.
Man, this has been so insightful. I feel like we've really gotten a good grasp of COPD.
Me too, yeah. It's amazing what we can learn when we really dig in, you know?
Absolutely. And I think the biggest takeaway for me is that even though COPD is a serious condition, there's so much that could be done to manage it and live a full life.
Couldn't agree more. Knowledge is power, and understanding this disease is the first step to taking control, whether it's for yourself or for someone you care about.
Well said. And here's a final thought for everyone listening. We talked about how smoking is the main cause of COPD. But, even if you've never smoked a day in your life, it's important to be aware of the other risk factors, like air pollution and those occupational hazards. So do your research, take steps to protect your lungs, and advocate for cleaner air. It's about being proactive and taking care of your health now to prevent problems down the road.
Couldn't have said it better myself.
All right, that's our deep dive on COPD. Until next time, stay curious, stay informed, and take care of yourselves.
Take care.
Bye.
Bye.